join will be able to see this later on. But to introduce myself, my name is Courtney. I am your company's direct contact. And what I want to do with this presentation is educate you a little more of one of your newest benefits, show you why it's important to use it, and then show you how to use it at the very end. I'm going to give you a quick app demo. So again, if everyone has their phones, that'll be perfect. I'll walk you through registration and then show you how easy it is to utilize this benefit. But we are Healthiest You, and we're your telehealth benefit. How many people are familiar with that term, telehealth? Is anyone familiar with that? Well, that's okay. So telehealth simply lets you talk to a doctor over the phone. And I'm not familiar with it yet, but that's okay. In the near future, it's going to be very predominant in our healthcare systems. And what we do, like I said, is let you talk to a doctor over the phone. So there is some skepticism at times when people aren't familiar with telehealth. They're saying, how can you talk to a doctor over the phone and get a prescription? Is that ethical? Is that legal? And the answer is yes. So over 70% of the time that we currently go to in-face visits can safely be handled over the phone based off of your medical history and your symptoms. So have you ever had that symptom where it's, kind of a nagging issue, and it probably happens once a year during that winter month, and it's the cold or flu, right? And you're thinking, man, I know exactly what this is, or something similar like an ear infection. You know exactly what it is. You're thinking, if I could only pick up that prescription and not have to leave my house, that would be amazing. So that's exactly what Healthiest You is we're kind of that connection for those acute illnesses, for things you can almost diagnose yourself that are easily diagnosed via your symptoms and your medical history. So think of your traditional healthcare cycle. Where do you guys start when you get sick, right? Do you diagnose yourself? Do you do nothing about it? Or do you actually take action and end up in the minute clinics or urgent care centers? Due to a lack of availability, a lot of people are defaulting to emergency room. So if you or one of your younger dependents wake up in the middle of the night with an ear infection and you're thinking, gosh, I need a prescription right now, a ton of people are going to emergency room. On average, it's about 2 weeks to get into primary care. So people typically aren't going to primary care. They're going to minute clinics or urgent cares, or again, that emergency room. Well, every time you go to one of these in-face consultations, you have to pay something out of pocket, right? Whether you're on that high deductible plan or the PPO plan, you're still paying something out of pocket. Then you have to wait in a waiting room that'll get you potentially more sick, or maybe someone else around you, you're going to get them sick, right? And on average, the last time you went to a doctor, how long did you wait in the waiting room? Typically 45 minutes to an hour and a half, right? That's on average. So with Healthiest You, there's actually no waiting time because you're calling at the convenience of your couch, right? Or your desk at work. There's no travel time because you're not leaving anywhere. But most importantly, there's nothing out of pocket to you guys. So it's $0 consultation fee, available 24/7, 365. So you guys could be calling once a day or 20 times a day, and you're still not going to get that charge. It's a $0 consult fee, unlimited access to you and your family that's on account. But most importantly, from a company employer perspective, there is no claim generated on the insurance. So why is this relevant to you? Why is it important to you guys? What this means to you guys is there's decreasing the utilization of the insurance, which means this could be cheaper for the company to pay for the insurance, which in turn means you guys could potentially pay smaller amounts per month for your premium. So that's how it's relevant to you. No claim is generated on the insurance, which means in turn we could potentially decrease the amount that you guys are paying for your premiums, right? In addition to $0 consult fee. These are the top 9 reasons people are currently visiting emergency room. And as I mentioned before, this tells me that it's more than likely the lack of availability. So people are waking up in the middle of the night and going to their urgent care for sinusitis, right? Your common allergies. That's, that hurts me because I don't want you guys to spend all that money out of pocket when we can safely handle this over the phone for $0 out of your guys' pocket. So become familiar with these top 9 reasons. I don't want to see you guys in the emergency rooms for any of these make sure you're calling Healthiest You first, right? There's no harm and foul in calling Healthiest You because there's never any charge to you, whether you're calling once a day or 20 times a day. The physicians that you guys are talking to on the other line is probably my top asked question. It's not a call center across the world. It's actually physicians that are licensed, board certified, and reside in your state. So it could be someone who's partially retired in the ER who wants more hours, or someone who just started, he has a family and he wants to have more residual income here. So whoever it is, they're actually licensed and board certified in the state from which you're calling. So we do travel with you guys. If you guys are in Arizona, a physician that's licensed here will assist you. The only state we're not available in is in Arkansas, because they're revising their telehealth regulations. But this is huge for, work travels. Maybe you get sick, you're on the plane, you get sick, and you're thinking, gosh, I had that meeting early tomorrow morning. I hope this doesn't get worse. You can call Healthiest You, tell them your symptoms, and get a prescription before you even, get to your hotel. And then the next day, you're good to go. You're sharp on point for that meeting. It works really well for those dependents who are away at college. Maybe they're in a different state. They're able to download our app as well and be assisted with a physician. On average, they have 18 to 20 years of experience. So well-versed physicians that you guys are talking to. Now that you know a little more about Healthiest You, how do you guys access it, right? So you can all download the free mobile app, and I'm going to show you guys how to do that here. You can access the same exact technology on your computers, or if you're not comfortable with that technology, maybe you're not as tech savvy, you can simply call the 866 phone number with your flip phone or old school rotary phone, right? Whichever way you guys want to, we're trying to be as accessible as possible. So I'm going to pull up my mobile app here. If you guys haven't already, pull out your phones and do it with me. So everyone will click first time here. No one has an email and a password yet. Everyone will click first time here. Everyone will select employee, even the spouse or dependent who is trying to register. And then you will put in the employee's last name, date of birth, and zip code. On the next step, it's going to pull up everyone that we have on account. For some reason, after this step, if it says, oh snap, we can't find you, we can't locate you, that's probably because we have a different zip code on file than what you're using. So make sure to give me a notification so I can verify what we have on account and get you guys registered. But again, on the next step, it'll say everyone that we have on account from the family. You'll select the name of who's registering. So if your daughter or son is trying to register, they'll click on their name. And then it's going to ask you to create your credentials. So what email and password do you want to log in with? The very last step is going to ask you for a phone number, and that's simply the phone number you want a doctor to call you back at. So typically your cell phone number. So I'm going to go back here and log into my account while you guys finish registration.
I'm a disappointed to it, but it's really slow.
Well, she didn't tell us how to get here.
Oh, okay. So I did hear something that someone isn't aware of how to get there. So in your App Store or your Google Play Store, we're going to search Healthiest You, all one word. So everyone search Healthiest You. And it's going to be an H and a Y orange logo. It's going to look just like this. You're going to click Get, and it will download the app. I already have it, so I'm just going to click Open. And again, for all those first-time users, we're going to click First Time here, select Employee, and input your direct information. Has everyone located that in their App Store or Google Play Store?
Not yet.
Okay. Well, I'll go ahead and log in here while you guys are still working on that. All right, so feel free to follow along on the screen. If you do have your app up and running, feel free to look at your screen. But anytime you get sick, the only thing you need to do is click Visit Doctor. It's very simple. This is one of the reasons why I encourage everyone to download the app, because you don't have to remember a phone number any longer. A physician is going to call you back at your number, right? And then it's also convenience of click of a button. In this day and time, everyone has their phone on them constantly, so it's really that convenience, right? It's already there. You don't have to remember any phone numbers. So when I get sick, I'm just going to click Visit Doctor. It's going to say who needs help, right? If you have a spouse or dependent, it'll say you or someone else. So right now, I'm just going to select myself. If it's your first time here, the first step is going to ask you to import or input your medical history. So, you know, any symptoms that you've had in the past, whether you have allergies or asthma, anything of that effect, it will ask you. So you're able to update that at any time. And then it's going to ask you what state do you want to call from. So I'm able to adjust this at any time. Again, the state of which I'm calling from, a physician that's licensed and board certified there will be assisting me. So I'm here in Arizona. I'll click Next. It allows you to select phone call or video call. So I'll select telephone. It says, here's your phone number. Is that still correct? I'm going to say yes. If that phone number is off by 1 digit, our physicians will never be able to contact you because they're going to be calling the wrong number. So always make sure that that's updated to the accurate phone number. So I'm going to click Next. It gives me the ability to input any photos if I wanted to. So if I had a rash, you know, my eczema broke out, I'm able to take a picture going on. And then I'm able to update my preferred pharmacy because this is where they're going to actually prescribe the medication. So I'll click Next. Now I'm just going to verify that all my correct. I'm going to agree to the terms and conditions and click Confirm. As soon as I click Confirm, a physician is going to call me back. Sometimes it's taken up to 5 minutes, but we promise you that we will call within the hour. So that's kind of our callback time there. On average, about 8 to 10 minutes, but definitely within the hour. So I'm going to go back, all the way back to my home screen. Let's say that you already input your medical history and you just needed to update it. On these 3 dashes here, I'll click on Settings. Oh, sorry, let me go back. I'm going to click on Medical History. And now I'm able to update this medical history. So you're required to do this before you talk to the doctor because this is how they help diagnose you. So make sure you go through that when you get the opportunity. The other couple things that you have access to is locating providers in your area. You're able to price prescription to make sure that you're getting the best value. So let's go ahead and look at price prescriptions. I'm able to type in any medication I want in here. After you type in a couple letters, it'll populate what it thinks you're trying to type. And this is going to be in a 5. I'm going to compare my prices. This is going to bring up the cash value of amoxicillin in my location, right? So the reason why I say cash value is now you're able to decide, is the cash value cheaper than my copay? If you use your copay, there's a claim that's generated on the insurance, right? So if you use the cash value, that's not generating a claim on the insurance. Now you can decide, you're just an educated consumer. Is this better for me to pay out of pocket? Is this cheaper? You know, whichever you prefer, you're able to use. So let's say that this cash value of $4 is cheaper than my copay. So I'd like to take that. I'm going to select it. I can either add it to my Apple Wallet and the coupon will be saved there, or I can save the discount card and it says this has been saved to your Today screen. So I'll say okay. I'll go back, all back to my home screen. And then as I scroll down, there's my discount card. All I would have to do is show that to the pharmacist and I'm good to go. right? Is there any questions about that pharmacy discount? Not to confuse you guys, if you use the discount card that is not generated on your insurance, that does not go towards your deductible, that's completely out of pocket, completely separate than the insurance, right? But always coming back to the fact that this benefit is primarily the doctor over the phone. There are a bunch of cool functions located right here under the apps part. So you can look up a certain diet. You can check your insurance if you input your insurance. You guys are able to track your deductible. You're able to search in or out of network providers. So if you were looking for a certain specialist, you could come in here, maybe I need my wellness visit. I can look up certain dentists, certain OBGYNs, whatever I need to look up. I have access to this in all one central location, but always coming back to the fact that this is the doctor over the phone. This is the way that we help you guys save money out of pocket as well as the company, right? So no longer do you have to wake up in the middle of the night and go to the urgent care centers. You're able to see you and be assisted right away. So do any of you guys have questions about this?
If you could just come up. My phone will do all that, but it's really slow.
Was everyone able to register? And if you don't have your audio on, feel free to put it in the little comment box so I can address any of your questions. How's everyone in the conference room doing?
Our internet isn't very good, so we're not able to really download it yet.
Okay, is everyone still loading on the download part?
No, we don't have an internet connection at the moment. Yeah, it's just not working.
Okay.
You're available if we do have problems.
Oh, yes, absolutely. If you guys have any questions about anything I reviewed, feel free to contact me directly. This is my direct line, and this is my email. So go ahead and send me a notification if you're not able to register. If you have any questions, go ahead and call me or contact me so I can assist you.
And then, Courtney, this is Marilyn. So I believe that this was recorded today, correct?
Yes, ma'am. Mm-hmm.
Okay. So in theory, obviously, if they weren't able to get everything up and running, they could just rewatch the recording of it.
Absolutely.
Okay. Okay, good.
Perfect. And I will send you a link as well. It's a quick little link that shows you how to register. It's a little video, so they can look at that as well. It's like a 2-minute link versus this 20-minute webinar.
Oh, and I appreciate you doing it, especially for you guys hopping on early in the morning. How many folks are on the call? Just so I can...
Let's see here. Yep, so it looks like 6 additional people are on the call.
Great.
In addition to the con.
Okay, great. And then I think the key to this, as we did open enrollment and we rolled out everything for you guys, was just really making sure that you register prior to having to use it. Because the key point is
absolutely.
I want you guys to have everything up and running, so when you're not, then HealthiestYou unfortunately has to tell you, hey, we need you to get registered, and I don't want that to be an unhappy experience for you. So it's really key to get everything up and running and registered prior to when you need to use it. So I appreciate Courtney doing this for us today.
Yeah, absolutely. And just to kind of touch on what Marilyn just mentioned, so if anyone is to call into the phone number, you're going to have to do registration over the phone with our Careline representatives. They're going to go through the exact you just went through on your app. That's why I do encourage everyone to download the app, because that eliminates going through that process over the phone. You get to do it yourself. For a spouse, they're required to do it over phone, but as a primary, you have the leisure to do it at your own time via your mobile app. When everyone else gets the app on their phone, they don't have the option to input their medical history. They click confirm consultation and someone calls them back immediately. But as a primary, that's kind of the convenience that you guys have, is to input your medical history directly, which definitely speeds up the process. It's much you know, when you're sick, I understand you don't want to talk to anyone but the doctor.
Yeah. Perfect.
Let's see here. For insurance info is Great West Healthcare. Okay, perfect. So when you guys are registering, you have the ability to select your insurance. If you didn't put it in during registration, you can always come back at a later time and input it. However, if it is not in our app, if it's not a selection in our app, then that means we don't have a carrier in our app, which isn't a big deal. You're not missing out on anything beside from tracking your deductible. So great question there.
And then Courtney, since I have you on the phone, so when I did open enrollment for Carbon County, you know, I indicated to them that obviously narcotics or any pain-related medication the doctor does not describe. Is that correct?
Yeah, absolutely. So no controlled substances are prescribed. Any prescription is up to the discretion of the physician if they're going to provide you that medication, right? So always think of that. In an emergency case, we're able to refill a prescription once every 6 months. So a couple of weeks ago, I did have a client who called me and told me, you know, I left my diabetes medication at home. Is this something I can call HealthySD for? And I said, absolutely. So she was traveling, forgot her diabetes medication at home, which is something she has to take on a regular basis. She called HealthySD and they were able to refill that prescription in that emergency case. So it's not something that we're trying to eliminate your providers. We're just trying to help in a time of need. But never hesitate to start with HealthySD. So in another situation, you know, if nothing else, you come away with advice. So in another situation, I had a client, this was a few months ago now, he was being a little bit stubborn. He didn't want to go to the doctor. And his wife told him, why don't you call HealthySD? We have it. It's free, even if you don't get a prescription. Calls HealthySD, tells them, you know, my arm's tingly, it's a little bit numb, this, that, and the other. Can you just tell my wife I'm okay? And our physician actually directed him to the emergency room because he was experiencing a stroke. So in that situation, we weren't able to take action on our end, but we were able to assist him in going to the right facility because it was an emergency and he didn't think it was, right? So it really works on both ends of the spectrum. Maybe you're not sure and you just need advice, call HealthySD. Maybe you really think you need that prescription and we're able to assist you, right? So again, no harm and foul in utilizing the benefit because it's at no cost to you guys. Take advantage of this. You guys have access to this. Make sure you and your families download the app and everyone's really utilizing this. If you have any skepticism and you call in and you realize how convenient it was and how personable our physicians are and how it was almost like an in-face consultation except for you weren't able to see the physician, you're going to love this, you guys. So just I encourage you to use it once and just see what it's about. And then moving forward, you can decide if you want to use it again.
Yep, I totally agree.
Perfect. Is there any questions? Yeah, absolutely.
Any questions?
All right, if there's nothing else, guys, go ahead and jot down my contact information and let me know if there's any questions.
Thank you, Courtney.
Absolutely. Take care, guys. Have a great afternoon.